Okay, good day all ladies and gentlemen. In this video, we are going to look at the facts, myth of female virginity and the hymen. Don't forget to subscribe, follow and join my YouTube community for more videos. So now, introduction to female virginity and the hymen. Female virginity is often culturally associated with the presence of an intact hymen. So when we said female virginity, culturally, people associate the presence of an intact hymen with virginity because that was actually the cultural thoughts that people are thinking that a female are considered virgin because of the presence of intact hymen. So ladies and gentlemen, in this video, we are going to look at whether the presence of intact hymen is associated scientifically with female virginity or not. Please follow me. First, what is hymen? The hymen is a thin membrane located at the opening of the female vagina. So it's mostly considered as a membrane that found at the opening of the female vagina. And the myths surrounding the virginity and the hymen have significant social and cultural implications because there are so many misconceptions and misinterpretation associated with the female virginity, socially and culturally. So that is why in this video, we are going to look at the myths and the fact surrounding the virginity and the hymen, and also the social and the cultural implications. So actually from this video, we can see clearly, ladies and gentlemen, this is actually the anatomy of the female vagina. And as you can see, there are different part of this female vagina, and part of it we have hymen involved like this. If you look at it, this is where we have the hymen. So what is hymen? Your hymen is a small, a thin piece of tissues at the opening of your vagina. So that is what you call hymen, and it is usually found at the opening of the vagina. It is very small and very thin piece of tissue. So now, what is the hymen? The hymen is a mucous membrane that can vary greatly in shape and size among individuals. So you should understand that this hymen is not the same in terms of the shape and size. One female may definitely have different shape with another female. And also their sizes differ from one another. And that is why we are also going to look at the different types of the hymen. So you can't expect the anatomical structures of female vagina to be the same across all the individuals. It's not the same. In fact, even the hymen, they have different shapes and they have different sizes depending on the individual. And it is not actually, please mark my word, it is not a reliable indicator of virginity because it can be stretched or turned through various activities. Because some people are thinking that when there is no intact hymen, it means that the female lose their virginity through sexual intercourse. And the truth is that it's not a reliable indicator of female virginity because these hymen can be lost or can be torn through various activities. It's not only through sexual intercourse. And these are actually the different types of hymen in female. Let's look at them. We have imperforate, that is imperforate hymen. We have annular hymen. We have denticular. We have calibriform. We have dentate. We have crescentic, we have labial, we have membrated, we have septate, lunar, microperforate, we have porous, introitus. These are the different types of hymen, and if you look at it, they have different sizes and they have different shape. And at the same time, please mark my word. Intact hymen is not a reliable indicator to confirm or to determine whether a female is virgin or not. So the hymen's appearance can naturally change over time without sexual activity. So that's why you need to understand sometimes if you overage at the same time, it can also lead to the changes naturally, the shape and sizes, and also the tone, tearing and the wearing of the hymen itself. So that is why you need to understand that it's not actually about sexual intercourse that make the mucous membrane change. As you overage, as you overage, the hymen can also be lost. So you need to understand that. So very importantly, ladies and gentlemen, a common myth, the myth surrounding the virginity and the hymen. So the common myth is that hymen must bleed during first sexual intercourse to confirm virginity. So these are some of the cultural and the social beliefs. That is one of the myths that they are thinking, or people are thinking, that a female must bleed because of the destruction of the hymen during the first sexual intercourse, confirm the virginity of a lady or of a female. Another myth is that the hymen completely disappears after intercourse. So people are thinking that the hymen usually disappears completely after having a first sexual intercourse. And many believe that an intact hymen signifies virginity regardless of other factors or experiences. So these are just a myth. These are just some cultural and the societal belief. But there are facts for we to understand about apart from this myth. Because number one, even a lady has an intact hymen, she must not be believed. She must not be bleed during the first sexual intercourse. This is just a misconception. And it might not be completely disappears. And that is not actually what confirmed the virginity of a lady. Let's look at the fact. What are the biological facts about the hymen? The hymen can be stretched or torn by activities such as support, tampon use, or medical examinations. Like if a lady involved in support, so the hymen can be stretched or torn through support activities or tampon use, especially when you have a plug of cotton which inserted into the female vagina, especially during menstruation. That is the tampon use. So that can also lead to the stretch or turn out of the female hair. Or sometimes through medical examinations. A lady can go for a medical examination and that can actually lead to the stretching or turn out of the hymen. And at the same time, not all women bleed during their first sexual experience, even if their hymen is intact. So you should get this. So even if a lady or a girl or a woman have an intact hymen, so she must not always be bleed during their first sexual intercourse or first sexual experience. So the presence or absence of a hymen does not objectively determine virginity or sexual activity. So you shouldn't use the presence or absence a of a hymen to determine the virginity or sexual activity of a lady or of a woman. Please, these are the biological facts. So then, the cultural impacts of myth and misconceptions about the female virginity. Number one, this myth, this myth can lead to shame, guilt, or social pressure for women who would not bleed or have an intact hymen. Because of course, there is this misconceptions that if a lady do not bleed during her first sexual contact, they found themselves shame, guilty, and social pressure, especially in some society. So in some cultures, an intact hymen is incorrectly used as a proof of chastity or virtue. Some cultures has this problem. And the misconception can contribute to harmful practice like virginity testing. Because of these misconceptions, some people will now say, okay, there are some harmful practices. Because these harmful practices is not reliable and unethical to say that you are going to test the virginity. So virginity testing is not ethical and is not reliable because after all, it may not give you exactly what you want as a result for the confirmation of the virginity. So that's why we have to remove these misconceptions, and forget about the myth that are associated with the female virginity. So then, in conclusion and education, so understanding the fact about the hymen helps dispel harmful myths and stereotypes. Education about female anatomy promote body positivity and informed health choices. So challenging cultural myths can lead to greater respect for females' autonomy and experiences. Please, ladies and gentlemen, this is Mukhtar Aliyu. Follow, subscribe, and join my YouTube community for more videos. Thank you very much and see you next.